We are committed to improving the health and well-being of our community, inside and outside our hospital and clinic walls. Only 20% of a person's health is shaped by the time they spend visiting a hospital or clinic. The other 80% of our health is influenced by things like health behaviors, socioeconomic factors, and our physical environment. These factors are considered social determinants of health, and when access to resources for well-being are limited, they can contribute to poor health outcomes, increased chronic stress, preventable diseases, and obesity rates. These are impacts we see on our patients every day. We don't have to wait for our patients to get sick, be admitted to the hospital, or even be prescribed medicine to support their health and well-being.
We have been a leader in many ways in terms of addressing inequities in healthcare, whether we think about it from who's delivering that care or the impact of the care we deliver. But our responsibility and the opportunity is to think much broader than that, to think outside of our walls, to think about healthcare as a more holistic concept.
This work is really critical right now because the status quo has been leaving too many people behind. When we think about health equity, we do need to incorporate this idea of systems and policies and the larger environment around each of us as individuals or as families, and how much that really impacts our ability to be well. There's increasing evidence and research pointing to this idea that zip code is increasingly more important than our genetic code when it comes to our health and well-being. My team and I get to do work that addresses the social determinants of health, and those include things like our physical environment, economic ability, mobility, and security, access to healthy food and physical activity, and mental health and wellness supports, as well as, of course, helping to navigate systems like healthcare and education and workforce. All of these things really help to broadly shape someone's health and well-being.
A great example of that is some of the vaccine work that we've done, where it wasn't just, come to us, come to our clinics. We went all over the state where we have presence to provide access points for people and used the community relationships that were there to build that trust that this was the right thing to do. So partnering with community organizations helps us to have a better understanding of what the community needs and to be able to deliver in partnership with people who have different access points and different approaches, more effective care in the community.
My team and I get the chance to represent our organization in the community. That means that we sometimes will serve as a convener if there is an issue in the community that needs to be addressed, that we can help to host that conversation and to bring together the different partners that really have a stake in this work, using our platform as a really large organization in this state to be able to lift up and advocate for issues that our community is really concerned about. I'm really excited that our organization is on this journey toward health equity and being an anti-racist and inclusive organization. And that's really a lot of work when we think about what it is that we're looking to address and how much time and systems have created the current environment that we're in. And also, we've played a role in creating the status quo. And so this is partially about taking a hard look at ourselves in the mirror and recognizing the responsibility and the opportunities we have to be able to create a better future with our communities.
I think our commitment to the community, it's lasting, right? We're in it for the long game. And it's to improve the lives of individuals and of the communities that they're in and that we serve. We have the privilege of being able to think over not simply months, but years and decades to continue to improve the health of our community.